Welcome, I'm so glad you all could join me. I'm Chava and you're watching Ask a Midwife. Hi everyone, it's Chava. I think it's really important to discuss briefly the plan for baby arriving before your midwife, or the plan for the baby arriving with you alone at home in a situation where you'd plan to go to the hospital, but suddenly the baby's coming out. Okay, so what are the things that you need to know? First of all, the thing I always tell women is that when the baby's coming, there's usually not a problem. The problems are more likely to happen when the baby isn't coming. So a swift birth doesn't need to be a traumatic birth, and it doesn't need to be scary. If you keep in mind these simple things, you should be able to actually have a beautiful, safe, healthy birth, even if you weren't prepared to be giving birth at that exact moment. The first thing to do is find your birth spot. A lot of women feel that pressure and they want to go to the toilet because that's instinctually, if you feel the urge to bear down and you don't know what it is, you'll run to the toilet. You feel like you maybe have to use the bathroom. And that's where a lot of times women discover that it's not in fact the need to use the bathroom, but it's in fact a baby's head coming down. First of all, you want to call for help. If anyone is there with you, you need to alert them. And if anyone is there with you, or you can grab a phone, you need to call for help. Okay, that's the first step. The first step is calling for help. The second step is getting help, or if you have strength between your own contractions, to get to a bed or to get to somewhere soft. The idea of standing and having a baby, standing up, squatting, is a perfectly fine idea if you have help. But if you're alone or you're with someone less experienced, you really need to find a place that's soft, a place that you can be in a comfortable position without there being too much room between your body and the soft area. So a side-lying position on a bed is a really good position. It's happened a couple times that I've needed to coach a woman through her childbirth on the phone with no one else there except for her husband. And I've had a few times that this has happened over the course of my practice. So basically, the thing I tell women to do is first, if it's really, really sudden, some women haven't even removed their underwear. So first step, take off the underwear and get down on a soft bed. Get down on a soft bed, a soft surface. Side lying is a really good position. So hands and knees is an instinctual position for a woman to be giving birth in. It's a little trickier for the person catching the baby because you need to basically receive the baby from behind her, but it's not really difficult as long as you realize that after the baby's coming out, she'll need to turn over in order to receive her baby, but that's actually not such a big deal. So if that's the position that she's in, if that's the position that you want to be in, that's also okay. You just really need to have some help. If you're by yourself, the very best position is on your side, where you can sit, sitting back against some pillows or on your side. That's the very best position for you to be in if you're by yourself. Really bear in mind that everything's okay. Keep telling yourself that even though it's intense, that your baby's coming out and you're going to be fine. If you're with someone who's panicking, I know this is sort of counterintuitive, but you can actually have a big effect on the person who's with you. You can instinctually reach inside, find that inner strength, believe that things are happening for a reason, believe that your body knows what to do. Clearly your body knows what to do. It's the baby's coming out. All the dilation and the opening stages and all the contractions and even the pushing, these things are all behind you. And now the baby is emerging. So it's really, really okay. Baby knows what to do. You know what to do. You don't even need to actively push unless you can't hold back. You can go ahead and push. The key is gentle pushing. When you're giving birth to a baby, the whole area down there will stretch. It will accommodate the size of your baby. The best way to avoid a tear is to do it slowly. So I'm not telling you to hold back. I'm just telling you to do it gently. If you try to, if you feel this overwhelming urge to push and you push your baby out and the head crowns and is born in like one push, it's more likely that you'll tear. If you put your hands down there, if you feel what's going on, I'm not talking about putting your hands inside necessarily, although that's okay if you want to check and see. If you feel the pressure and you're wanting to know what's happening, you want to get some information, you can put your hands down there. It's perfectly fine. And it's your own body and it's your own hands, it's your own baby, so that's perfectly okay to do, and I'll give you a lot of information. It's a lot better than someone else looking and trying to describe to you what they're seeing. You go ahead and put your own hands down there. That's okay to do. What you'll feel is probably a hard, possibly a wrinkly possibly a wrinkly, hard head. You'd think it would be smooth, but it's actually can be kind of wrinkly looking. And you'll feel that hard, bony head that isn't you, and that's your baby. Okay, so what you want to do is you just put your hand down there, and as you give little pushes, you're going to feel that more of that head appear. At some point, it's going to be a really large diameter, and you can just keep holding your hands down there. If you can't hold your hands down there, that's also okay, but that's the moment before the head is going to be born. Once the head comes out, you're going to feel some relief, and then you need to wait a few moments, whether it's a minute, whether it's 30 seconds. It doesn't matter as long as the baby's head turns. Your partner might see this. You might notice, as if your hand is still down there, you might see it if you're able to look. As soon as the baby turns with her head facing your thigh, generally that's how it happens, you'll feel another big urge to push, and you can push again. Then the shoulders will be born. The important part is the baby's coming out, and your hands are there to receive her. If you're on your side on the bed, this makes a really good angle for you to see and feel, and also to receive her. After she's out, you want to gently pull her up towards you. You can kind of scoop your hands under her armpits a little bit, or if you have help, they can help you. The person with you can help you. Just gently lift baby up. Now, the cord is going to be attached to her belly button, and attached to her abdomen, and then going up inside of you. So you don't want to put pressure and tension on the cord at her abdomen, at her tummy, or at your vagina. You don't want to, that's going to be uncomfortable for you and uncomfortable for her. So you just want to bring her up onto your tummy as far as she'll go without putting pressure on the cord, without putting tension on the cord, without pulling. Okay? As she's on your tummy, grab a towel, grab a clean shirt, grab something clean and dry her. Babies are usually quite wet when they emerge, and you don't want her to get cold, especially if it's in the wintertime, and even if it's on a summer day. The difference in temperature from the inside of you to the outside of you, even on a warm summer day, is quite profound for her, and she could get cold even on a warm summer day. So dry her off and just hold her. And if you see some, black, dark baby poop kind of trailing up from her bottom or even all over you, that's a good sign. That's called meconium, and it's a normal thing that happens when the baby gets squished out. Everything kind of gets squished out. And don't worry about the mess. Don't worry if there's a little bit of blood. Don't worry about all the fluid around. This isn't the time to worry about how much of a mess you made. Remember to keep calm and just to be present. It's really, really important that you try to enjoy this moment, even though it was a shock, a surprise. You're looking at your partner, you're looking at the person who helped you. You can't believe it, what just happened. Like 20 minutes ago I was making dinner, and then suddenly I felt a pop and a gush and some pressure, and here I am, and the baby's born, and wow. And then at that point, possibly whoever you've called might be arriving, possibly a midwife, possibly a nurse who's a neighbor, possibly an ambulance. Possibly you didn't get a chance to call anyone, and that could be okay too. You'll notice that within moments of your baby emerging, she'll start to cry, and she'll start to make noise, and she might start to gargle and breathe, and that's a really good sign. If she comes out and she's all floppy, and you're not really hearing any sounds from her, what you want to do is dry her really well. This is a really important part. And you and your partner both, or whoever's with you, need to speak to her. You need to talk to her. You need to stimulate her. If she has a name, you can call her by her name. Whatever it is, you need to try to connect to her, talk to her, rub her vigorously. No spanking or patting. You can massage her feet vigorously, like right in the middle of her little baby feet. In almost all cases like this, there's no emergency. If the baby's come out suddenly and she's breathing and she's crying and she's a good color, you can tell she's a good color by, looking at her skin and seeing is she a dark, purple color. When she's first born, you'll see that she's a dark purple color, and that's normal. Babies are born blue. And when you hear, oh, wow, my baby was born blue, all babies are born blue. Within moments, minutes sometimes it takes, they pink up. Their color changes and they become pink. When they breathe air, when they become pink. It's not a problem if they're born blue because this is normal. It is, however, a bit of a concern if they're born white limp and floppy. White, limp, and floppy is a danger sign, and you need to get help right away. So as far as the placenta, which is still inside of you, at some point in the few minutes to even up to an hour after your birth, you'll see a gush of blood from your vagina, and that is a sign that your placenta has separated from the wall of the uterus. This happens naturally and normally through the course of the third stage of labor, which is after the baby's born. Your uterus still contracts, and what happens is those contractions cause the placenta to come off of the wall of your uterus and drop down into the lower part of your vagina where it's ready to be pushed out. You'll feel a cramp, you might feel some odd pressure, and that's the sign to your body that it's ready, to give birth to the placenta. You can actively push. Women are often a little bit, freaked out to push again after they just pushed out a big baby. Don't worry. It doesn't feel like the baby's coming out again. It doesn't have any bones, and it just kind of plops out of you. It just kind of oozes out. It's a weird feeling, but it's really, really a relief, because what happens is after the placenta's out, then your uterus can fully contract and get tight and hard around the wound that was naturally created by the placenta and stop any bleeding. When you give birth to the placenta, it's a good idea to put your hand on your tummy and just give it a little rub. You'll feel what feels like a grapefruit underneath the skin of your abdomen, like right above your pubic bone and right around your belly button. You'll feel kind of like a big hard grapefruit down in there. You might have to kind of dig a little bit, but if you don't feel that, or if you see some bleeding, you're going to want to put your hand on your tummy and give it a nice rub, and that should firm up, and you're gonna feel contractions after the birth. Now, if you put your baby to your breast, most likely your baby will start smacking and respond to your nipple, and you might even be able to get your baby to latch on, which means to attach herself to the breast. If you can get the baby attached to your breast, that's a really, really good thing, because that stimulates your body to produce the hormone called oxytocin, which stimulates contractions and will keep the blood loss to a minimum. At that point, if help hasn't arrived yet, you can just enjoy your baby, and nursing your baby is really healthy. It is important to make sure that baby is responsive, warm, and that you're not losing blood. Those are the three most important things. When you dry your baby with the first towel or blanket that was handy, you'll need to switch that towel or blanket with a dry towel or blanket in order to keep baby warm. If it's a really cold day, you might want to wrap the baby up, but it's generally a good idea to keep the baby on the mother, as that you're a really good way to help the baby regulate her temperature as she sort of copies your temperature. Her skin, she's lying sort of tummy to tummy, with her skin on your bare skin, and you're both covered with a warm blanket. That's usually the best way to go as far as helping the baby stay warm and dry. And generally just want to make sure that she has that she's not smushed into your stomach in a way that she can breathe. So you just want to make sure, look at her face, see that she has an airway, see that she's pink, see that she's warm and dry. You don't have to do anything with the cord. There is no hurry, there's no rush, there's no emergency or urgency to cut the cord or do anything at all. You can take that placenta that plopped out of you, and you can wrap it in a towel, you can put it in a Ziploc bag, you can put it in a bowl and just set it, at a comfortable distance from the baby, as the cord will still be attached. So you really want to make sure that there's no tension on the cord. Make sure that the cord isn't pulling on the baby's belly button at all. Okay? As far as that, if you feel comfortable, shifting around a little bit and having someone help you get cleaned up, that's okay. But the general rule of thumb is just to kind of wait until help comes. At this point, you could stay like this for even an hour or two, depending on, what your situation is. At some point, it could be that an ambulance comes to take you to the hospital, and at that point, the paramedics or the EMTs will assist you, and hopefully they're calm. If you all are projecting calm, and then you'll influence the people who come to help you. Sometimes an ambulance team can arrive at a house and really change the energy. They come into an emergency, what they feel is an emergency, and you've had this beautiful home birth. So you can always smile and say everything's fine and look how cute my baby is, and they'll get the picture pretty quickly that it's not an emergency and they just need to give you a ride to the hospital if that's what you choose to do. And you might choose to stay home as well. They might help you. They might be able to help you cut the cord and kind of examine the baby. And at that point, you'll decide what to do. You'll make the right decision. There isn't one right decision and there isn't one wrong decision. If the baby looks great and you want to stay home with your baby, you can make that decision. But I do advise you to get some kind of skilled medical advice, even if it's just getting a midwife who, you know, a family friend on the phone and you can talk to her. And you should get the baby checked. You should get the baby checked by a pediatrician within the first, you know, day or two. I think that's really important as well. And someone should look at the placenta to see that it's all out. Someone should check your bleeding. And if you don't have a midwife or a doctor, you should have someone following you. You should get one because you should have someone following you in the postpartum period just to make sure that the bleeding is stopping and that the uterus is going back to normal and to its, you know, normal postpartum uterus. Some other tips that I have for you are feed yourself, hydrate yourself, and rest as much as possible after this experience and during as well. If you can grab some water or grab some juice for your, if you're the labor partner, if you happen to be the, you know, unwitting labor partner, suddenly you're in a position where you're delivering a baby or helping a woman to catch her own baby, grab some juice and you drink some too. It can be kind of a stressful and exciting experience to do this, and so you really need to take care of yourself as well, in terms of, you know, processing the event and talking about it and experiencing it and really, you know, enjoying it. It's not everyone that has such an easy experience that suddenly she's just having a baby. So hopefully this helps you. Hopefully you're able to gather some valuable information. And this is actually a really good mini class for those of you who just want a little overview of the birth as taught from a midwifery perspective. And even if you don't have your baby suddenly at home by yourself one night, it can be a really valuable thing to listen to this little video, and hopefully you'll get some good information just for your own birth as well. Hopefully you'll join me next time. This is Chava, and you're watching Ask a Midwife.